afternoon, Dr. Berger.
Good afternoon, Irina.
Can you speak today about PCOS and correlation to the weight management?
Of course. So PCOS, or polycystic ovarian syndrome, is an issue that many women deal with and can cause issues with weight gain. Just a little bit of background on PCOS. There are 3 criteria. If you meet 2 out of the 3 of them, the diagnosis is made. They're called the Rotterdam criteria. They include, of course, polycystic ovaries on ultrasound, but also evidence of elevated androgens or male sex hormones such as testosterone and DHEA, either on lab test or clinically, which often presents as male pattern hair. So examples would be in the beard line or in the middle of the chest. And also irregular menses or stopping of menses when the patient is much younger than that would be expected due to perimenopause or menopause. So 2 out of the 3, so even if you don't have polycystic ovaries on ultrasound, the diagnosis can be made. Some of the issues that come along with it metabolically are weight gain and insulin resistance. So first line treatment is really lifestyle management and weight loss. So proper nutrition with a diet such as perhaps the Mediterranean diet or a ketogenic diet, and exercise 150 minutes of moderate intensity per week and 2 strength training sessions, good sleep, managing your stress, etc. In terms of medication, metformin is still considered first-line treatment, but the GLP-1 and GLP-1 GIP receptor agonist medicines, so things like semaglutide and tirzepatide, can also be very, very helpful with or without metformin in terms of managing weight and also improving insulin sensitivity. It can also be used with metformin. There are a variety of ways that we can approach it. And another issue that can go along with PCOS is difficulty conceiving a child. And while a patient should be off semaglutide for 2 months prior to trying to conceive and off tirzepatide for 1 month prior, basically getting one's weight and insulin sensitivity back in order can really help. But we've had several patients who we got their metabolic issues under better control through lifestyle and medication, and then when the time was right, they were able to conceive. So of course that can be a really wonderful thing if this is one of the patient's goals. Of course you need to be on proper contraception if you don't want that to happen. So between lifestyle, metformin, and some of the newer GLP-1 and GLP-1 GIP medications, a lot can be done. It can relieve a lot of the symptoms, such as the hair growth, as well as the metabolic problems of insulin sensitivity problems and weight gain. So there is relief if you are someone who deals with PCOS. Remember, of course, everything that we share in these videos is for educational purposes only. No doctor-patient relationship has been formed, and if you have particular questions or concerns about your health, please don't hesitate to reach out to your medical providers. If you'd like to speak with us, we are Northeast Medical Practice. I'm Dr. William Berger, and you can reach us in the office, 516-604-3418, or online at northeastmedicalpractice.com. Check out our social media channels or our Longevity MD podcast on Spotify. But until we see you next time, be in good health.
Thank you.